Welcome back to Optimize Health, where we're making easy, healthy, and delicious meals. Today we're continuing an informative video series on our diet and lifestyle, as well as addressing these issues in cycling women, having their hormonal cycle. You should talk to your doctor, healthcare provider, or veterinarian to see if any of these recipes, suggestions, or contents of these videos are right for you. Nothing contained in these videos are intended to be taken as medical advice. Use at your own risk. So I wanted to get into a couple specific things. For today's talk, we're trying not to get too detailed, but discussing intermittent fasting or the time-restricted feeding, as well as low carb. And another important component we have to bring on board is circadian rhythm and how that comes into play. So briefly to overview, if you're not following the series yet, you need to know the basic three components to sort of designing a diet approach is going to be what you eat, how much you eat, and when you eat. We are trying not to worry about how much we eat, and we're focused more on when we eat and the quality and components of what we're eating as far as like macros. And obviously micros are important, and we should be supplementing probably needed, I would say where it's needed, but in general it's probably better to have a like an insurance policy vitamin supplementation program as opposed to not having one and risking deficiencies, especially when you're doing a fasting based dietary approach where it can be hard to get everything in as far as your eating in your eating window. So for intermittent fasting and keto, the reason it's superior to calorie counting rather, is that you're able to put this beneficial macro nutritional approach, low carb, which is lowering insulin and keeping it steady, and then you're combining that with a time-restricted feeding window, which is going to be in sync with our circadian rhythm. Diets and weight loss are not about calories in, calories out. There's a strong hormonal component as people are catching on to more in mainstream, and they're seeing how Ozempic is so effective. This is a hormone. But naturally, we can manage our hormones without paying a lot of money and risking horrendous side effects if we could and would just use time-restricted feeding. And we can do a daily intermittent fasting. 16-8 is a really good target. If you can do more occasionally, that's maybe better for certain benefits, like doing a 20 fasting and a 4-hour feeding window. And the benefits of this, particularly it's when we eat, it can be even more important than what we're eating, even though we want to be optimal and eat higher quality foods, keeping our carbs low and appropriate to our activity level for our hormonal cycles. If we're females, we want to do carb cycling during the appropriate times of the month. And so I'll get into that in another discussion as far as carb cycling. But our intermittent fasting is going to be optimized if we are eating during daylight hours and fasting during nighttime hours. So when the sun is out, we can choose our fasting window to start, for example, 11 a.m. to end at 7 p.m. In the summer. In the winter, maybe we want to start at 10 and end at 4 in the winter, because the sun is not out as long, and that can really help to keep our weight in check and potentially helping us lose weight during a difficult time hormonally for anybody is going to be winter as far as losing weight. Just to touch a little bit on some of these benefits, low carb is going to help potentiate our lowering and controlling our insulin, and also helping our triglyceride and glucose levels be in balance, which will then decrease risk of diabetes and heart disease, which are our main concerns in Western civilization. We also know that intermittent fasting can help with longevity and those kind of the milieu in the body chemically to improve autophagy and healing and repair to minimize damage long term, which then can promote healthier cellular level function and therefore like anti-aging sort of benefits there. So along those lines, we will get into further details about how to do this and how to put it all together in future episodes. But I definitely want to hear your thoughts and comments, suggestions, and requests for additional topics. And appreciate you joining.